Fundamentals Chapter 13. Advanced Topics and Treatments. Learning Objectives. After completing this chapter, you will be able to explain advanced skincare topics and treatments for licensed, trained estheticians. Describe chemical exfoliation and peels. Identify how to safely and effectively use chemical exfoliation and peels. Discuss the benefits of microdermabrasion by type of device. Explain the benefits of laser technology. Explain the benefits and types of light therapy. Discuss microcurrent treatments. Discuss ultrasound. Discuss microneedling and nanoinfusion. Describe spa body treatments. Discuss common treatments used to address cellulite. Explain the benefits of manual lymphatic drainage. Describe the field of medical aesthetics. Explain advanced skincare topics and treatments for licensed, trained estheticians. Understanding the foundations of the equipment, indications, and contraindications will enable you to employ combination therapies that will yield greater results and client satisfaction. Advanced treatments have expanded the esthetician's repertoire to include more results-driven treatments such as chemical exfoliation and microdermabrasion, microcurrent, ultrasound, and light-emitting diode, LED. Figure 13.1. With new technologies being developed, the world of aesthetics continues to grow. Estheticians should study and have a thorough understanding of advanced topics and treatments because advanced machine technology is always being developed and improved upon, and some of these technologies are expansions from the original formats. Offering advanced treatments will keep technicians competitive in the marketplace. The esthetician's professional expertise in analyzing the skin and recommending the best program helps make these procedures safe and effective. Describe chemical exfoliation and peels. What is chemical exfoliation? In the field of skincare, we define the process of removing excess accumulations of dead skin cells from the corneum layers of the epidermis as superficial peeling, exfoliation, keratolysis, and desquamation. These are interchangeable terms. This process can be accomplished mechanically, microdermabrasion, manually, scrubs, or chemically by the use of specific products, enzymes, alpha-hydroxy acid, AHA, beta-hydroxy acid, BHA, light Gesner's, and light trichloroacetic acid, TCA, peels, formulated to achieve this result. Advanced training and certification are necessary to perform exfoliating treatments and peels. Peels and chemical exfoliation services are efficient and take less time than the more relaxing, in-depth facials. Peels and chemical exfoliation services yield more significant results, help produce a clinical change in the skin, and are commonly used to address photoaging, acne, and hyperpigmentation, in addition to other conditions. Caution. Each regulatory agency is different, so check your local laws to see what is acceptable related to performing exfoliation services under your aesthetics license. Chemical exfoliation and chemical peels come in many different formulations and strengths. Your regulatory agency will determine the guidelines regarding the strength and pH of the products you can use. You will determine the treatment protocol, including the type of acid, the procedure time, the strength, the application process, and the assisting ingredients. Protocols vary depending on the product line, but the basic process consists of applying the product, neutralizing, and removing it within a few minutes. Some peels do not require neutralizing, as they are self-neutralizing. Acid, alkaline, and pH relationships. To understand the strengths of peels and the different formulations, it is important to understand acid, alkaline, and pH relationships. pH is an especially important consideration in peel products. Acids have a pH of 0 to 6, neutral is 7. Alkalines range from 8 to 14. The average pH of skin is 5.0, typically between 4.5 to 5.5. Acids penetrate the skin and can be a cause of irritation because of their small molecular size. A pH of less than 3 is not recommended for salon peels, and most states do not allow use of a lower pH. Buffering agents are ingredients added to products to help make them less irritating. Products with a higher acid percentage and a lower pH are more irritating. The acid needs to have a pH lower than the skin's pH to be effective. Figure 13.2. Potential hydrogen, pH, scale is used to measure the acidity and alkalinity of substances. Putting it into perspective. A spa level of 30% concentration of glycolic acid is usually formulated to have a pH of 3 if it is buffered properly. Physician peels have a higher percentage concentration and lower pH. Over-the-counter, OTC, AHA home care product formulations contain from 2 to 15% acid. AHA home care product formulations sold by spas range from 5 to 10% acid. Physicians carry home care products with higher percentages of acid. Peels are sometimes used to restore a skin's natural glow, which can be inhibited in hyperkeratinized skin and skin that is not functioning optimally at the physiological level. The cell renewal factor, CRF, or cell turnover rate, is the rate of cell mitosis and migration from the dermis to the top of the epidermis. This process slows down with age. The average rate of cell turnover rate for babies is 14 days, for teenagers, 21 to 28 days, for adults, 28 to 42 days, for those 50 and older, 42 to 84 days. Keeping cell mitosis going is one of the goals of skin preservation. Factors influencing the CRF include genetics, the natural environment, and one's medical history, lifestyle, personal care, and exfoliation methods. The keratinized corneum layer is composed of approximately 15 to 20 layers and varies in thickness in different body areas. While exfoliating is great for the skin, a hydrolipidic balance must be maintained, especially for alipidic, dry skin. Overpeeling is detrimental to the skin, and monitoring the client during a treatment plan is imperative. Light, medium, and deep peels, what is the difference? Superficial peeling removes cells from only the stratum corneum. Superficial or light peels, chemical exfoliators, are esthetician-administered and generally, according to state-mandated license scope and practice, include enzymes, glycolic acid, 30% or less, lactic acid, 30% or less, and in some cases Gessner's solution and low percentage TCA, 1 to 3 layers. The term chemical exfoliation is sometimes used in place of the word peel to differentiate between the medium and deeper clinical peels and the lighter chemical exfoliation used in spas. Figure 13.3. Before and after chemical skin peels. Physicians use high-strength peel formulations that are designed to penetrate deeper into the skin, the dermal layer. These peels are commonly referred to as medium or deep peels. Peels administered by physicians make use of the following chemicals. Resorcinol. Phenol, carbolic acid, also called Baker's peel. Trichloroacetic acid, TCA. Glycolic acid, 50% or more. Gessner's peel, 4 to 10 layers, which contains lactic acid, salicylic acid, and resorcinol in an ethanol solvent. TCA, a medium-depth peel that removes the epidermis down to the dermis. Phenol, a highly acidic deep peel that peels down into the dermis. This peel is not commonly used, but is still important to be aware of. Medium-depth peels are performed primarily with stronger TCA concentrations by physicians to remove the entire epidermis and part of the papillary dermis. Although not used often, deep peels are performed primarily with a phenol solution by physicians to peel deep within the dermis. There has been a movement toward the use of ablative lasers, erbium and fractional CO2, versus deep peeling solutions due to the ability to control the depth of the procedure with the former method. With lasers, you can limit the number of passes, but peel solutions may penetrate beyond the desired depth. General effects of chemical exfoliation and peels. Peels and chemical exfoliation result in improved texture of the skin, barrier function, and moisture retention. Increased cell renewal factor, CRF, hydration, and intracellular lipids. Reduced fine lines, wrinkles, and surface pigmentation. Skin that looks and feels smoother and softer. Improved skin conditions such as acne, hyperpigmentation, clogged pores, and dry skin. Potential stimulation of elastin and collagen production. Keep in mind the more intense the peel, the better the results, but you must also use caution to avoid complications. The client should also be made aware of the differences in downtime as it pertains to peel intensity. General contraindications to and precautions for chemical exfoliation and peels. Exfoliated skin needs to be protected from sun exposure and tanning to avoid hyperpigmentation and damage to the skin. Sunscreen must be used daily when using AHAs or other strong exfoliating products or treatments. Chemical exfoliation and peels can result in burns that may require medical attention and can scar a client. It is important to obtain as much training as possible in working with chemicals. Consult with the client before applying a chemical exfoliant, follow the manufacturer's instructions, and whenever possible perform a patch test, inner arm, inner wrist, inside crease of elbow, or behind the ear, 24 to 48 hours before giving a treatment to watch for adverse reactions to the product. Chemical exfoliation contraindications include the following: recent cosmetic surgeries, laser resurfacing, chemical peels, or dermabrasion. Recent injectables, fillers, or Botox registered, note, depends on how recent and the depth of the peel, so ask your physician or specialist that administered the treatment. Use of Retin-A registered or other medications that exfoliate or thin the skin, for example, client must be off Accutane's 6 months prior to the service. Allergies or sensitivities to products or ingredients. Pregnancy. Active herpes simplex. Hyperpigmentation tendencies. Inflamed rosacea or acne. Infectious diseases. Open sores or suspicious lesions. Sunburn or irritated skin. Photosensitizing medications make skin very sensitive to sun. Other contraindicated drugs or medication. Caution. As you learn more about facials and related treatments, you will become more familiar with the term contraindication. A contraindication is a predetermined condition that exists in your client that excludes them from using certain ingredients or products and/or from having certain treatments. To prevent skin damage, warn your clients to avoid sun exposure, scrubs, rubbing, pulling dead skin, depilatories, waxing, benzoyl peroxide, and exfoliating or glycolic acid products for at least 24 to 48 hours before or after any chemical exfoliation procedure. Recommend a longer period of time if the client's condition warrants it. Check-in. What are the benefits of chemical exfoliation? What are general contraindications for chemical exfoliation? Identify how to safely and effectively use chemical exfoliation and peels. It is important to identify the types of chemical exfoliation and peels available in the market today, and to understand the benefits and contraindications for each. What is an enzyme peel? Enzyme treatments are often referred to as enzyme peels or an enzyme mask. Whereas physical exfoliants work to slough off dead cells sitting on the surface of the skin, enzymes are proteolytic in nature and work to digest the keratin, protein, in dead skin cells on the surface of the skin. Enzyme treatments, depending on their composition and your client's skin, can be gentle enough to repeat once a week. You will find that most clinical facials include the use of an enzyme mask for enhanced exfoliation and to assist in preparing the skin for easier extractions. Enzymes can also be combined with microdermabrasion, may be referred to as microdermabrasion peel combination, LED, and many other advanced treatments to prepare the skin to yield greater results and/or enhance exfoliation. You will find that enzyme treatments come in a couple of different forms, such as ready-to-use masks or a powder with a liquid activator that you need to mix just prior to application. Ingredients found in enzymes include bromelain, which is derived from pineapples; papain, which is derived from the papaya fruit; pancreatin and trypsin, which are derived from meat byproducts. Always follow the manufacturer's directions for mixing, applying, and removing any enzyme treatment. When to use enzymes. When determining whether a treatment is appropriate for a client, consider the following factors: skin type, sebaceous gland activity, skin conditions, the client's philosophy of sun exposure, their cosmetic and product use, and whether they are using retin A, other acids/AHAs, and/or acne drugs such as tetracycline or doxycycline. Enzyme peels can be applied once every 1 to 2 weeks, but are usually used in conjunction with a clinical facial or to prepare for an advanced treatment such as microdermabrasion ultrasound or LED. Enzymes are not typically used prior to a chemical peel. Effects of an enzyme peel. The results are very superficial, temporary, and provide a refreshed dewy complexion but none of the in-depth clinical changes such as those as seen with AHA, BHA, Gessner's, or TCA peels. Because most solutions will be in the form of a mask, you may be unable to see the skin's response and you will rely on information obtained from the client to determine if the mask is processing according to expectations. There should be no reaction beyond very light tingling or the absence of any tingling. If you are applying a mask you can see the skin through it, it is expected to initially see the skin experience a very light erythema or even turn pink. The client may experience minimal or no tingling while the solution is actively processing. You are looking for pinkness, not redness, as this is an enzyme peel. Contraindications and best practices for enzyme peels. Remember to always consult the manufacturer's instructions. Eyewear is always recommended to protect the client and technician. OSHA requires that any time a corrosive agent is used, the technician must wear protective eyewear with side shields. An OSHA-approved emergency eyewash station is also required. Not all enzymes are categorized as corrosive, so you must consult the SDS sheet provided by the manufacturer for full information. The manufacturer will provide instructions on the application and removal processes. The general application process for a basic enzyme peel involves cleansing, toning, applying the enzyme peel, processing according to the manufacturer's instructions, rinsing, and applying moisturizer and a product with SPF. Some areas of the face may process sooner than others and you may need to perform spot removal on those areas. Some clients' entire face may process sooner than the manufacturer's recommended minimal processing time, in which case you will need to remove the entire peel immediately. Perform. Procedure 13:1 Enzyme mask. The best rule of thumb as a newer esthetician, who may not yet have mastered efficient application and removal processes, is to be prepared to remove the peel just prior to reaching the endpoint to ensure you can complete neutralization and removal before the client becomes overprocessed. It is also recommended to have a closed container of extra 4x4 moistened aesthetic wipes available for use if needed, as you will need them readily accessible. Perform. Procedure 13:2 Back facial with enzyme mask. What is an AHA or a BHA peel? Alpha hydroxy acids, AHAs, are mild acids that come in different percentages and pH levels and help to dissolve the desmosomes between cells to keep skin cells exfoliated. AHAs penetrate the corneum via the intercellular matrix and loosen the bonds between the cells. The intercellular matrix between the skin cells consists of ceramides, lipids, glycoproteins, and active enzymes. AHAs also stimulate the production of intercellular lipids. Glycolic acid, a commonly used AHA, can penetrate the epidermis more effectively because it has the smallest molecular size of the AHAs. Follow the light glycolic peel procedure as described in Procedure 13:3. Figure 13:4. A glycolic acid exfoliation treatment. Most AHA peels you will use will not be at a level that will yield any peeling or flaking. AHAs include: glycolic acid is derived from sugarcane and is the strongest AHA. Lactic acid is derived from milk. Tartaric acid is derived from grapes. Malic acid is derived from apples. Citric acid is derived from citrus fruit. Citric acid is now considered an AHA, rather than a BHA. Mandelic acid is derived from bitter almond. Perform. Procedure 13:3 Light glycolic peel. BHAs work under the same premise as AHAs but are better suited to dissolve oil and are primarily used for oily skin and acne. You will find that BHA peels are usually stronger than AHA peels, but this will depend on the chemical formulations. You may encounter some slight flaking or mild peeling, depending on the strength of the BHA peel. Caution: when employing BHA peels, keep in mind that aspirin is derived from salicylates, so clients who are allergic to aspirin may be allergic to salicylic ingredients. Clients must be directed to follow all home care regimens to ensure optimal outcomes and to minimize complications. BHAs include salicylic acid, which is derived from sweet birch, willow bark, and wintergreen and has antiseptic and anti-inflammatory properties. When to use AHA peels. When determining whether an AHA peel treatment is appropriate for a client, consider the following factors: skin type, sebaceous gland activity, skin conditions, the client's philosophy of sun exposure, their cosmetic and other product use, and whether they are using retin A and/or other acids/AHAs, or acne drugs such as tetracycline or doxycycline. It is preferred, but not required, that clients begin a home care regimen to prepare the skin for peels, but not every client is willing to commit in this way. Pre-treating assists in providing optimal outcomes because you are beginning the plan with a more acclimated and prepared skin surface. A home care plan should include at least a cleanser, retinol and/or AHA cream, vitamin C, and a product with sunscreen. Other products should be added according to the issues that you are targeting, such as skin lightening products for pigmentation issues. Home care plans that work in tandem with the in-office clinical treatment plan are very important. The best way to convey their importance to a client is by emphasizing that you are providing the peel to assist in restoring the skin to optimal functioning capacity, but you are not performing any home maintenance. Neglecting the home maintenance is like taking 2 steps forward and 1 step back. The home care plan is similar to the pre-treatment plan mentioned earlier in this discussion. Treatment plans begin with a series of treatments to jumpstart progress. A series can consist of 6 to 8 peels administered once a week over 6 to 8 weeks. During the series and at the end of the series, monitor the client's progress and determine if the goals have been met or if you need to administer another series. Your assessment determines the number of sessions and the length of the series. Move up to a stronger peel, or move to the maintenance phase. In the maintenance phase, you maintain the results by administering a monthly maintenance peel. You may also boost progress throughout the year by adding a series when desired. An example would be to schedule a series every fall to address any summer photo damage. Some technicians' treatment plans work on a graduated peeling system where you start with the mildest level peel, such as a 2% lactic acid, for the first couple of peels in the series and then move up to a low-dose glycolic acid, working up to a 20% glycolic acid and then ending with a 30% glycolic acid. Stronger superficial peel treatment plans are administered to clients whose skin is cleared for this level of peeling and to those who want to achieve faster results or have conditions that are better addressed with a stronger superficial peel, such as severe sun damage, more in-depth age-related skin issues, or hyperpigmentation. An example is a series of 5% TCA peels once every 3 to 4 weeks or 10% TCA once every 4 weeks. When working at this advanced level, the technician needs to be very diligent in monitoring progress to ensure they are administering the next peel only well after the skin has recovered from the previous peel. Client input is paramount. Photo documentation before and after peels and during the series is advantageous because it is good business practice for your personal records and it is also beneficial documentation of the client's progress. Important reminder: peel schedules depend on the product's strength and the client's tolerance of the procedure. When to use BHA peels. Pre-treatment and home care guidelines are the same as for AHAs, but you may add in products specifically for clients with oilier skin and with acne, for example, an acne and blemish serum. BHAs are used primarily on clients with oilier skin and with acne. You will find these peels usually come in strengths of 20 to 30% and are much stronger than AHAs, so you will most likely administer the peels only once every 2 or more weeks. clients will notice flaking and peeling, so it is important to mention this in the consultation. It is advisable to start with a lower strength and work up once you have a baseline for the client's reaction to the procedure. A series can be implemented according to your client's goals and the outcomes achieved. The maintenance phase begins once the goals have been met and you want to maintain the results. Contraindications and best practices of AHA and BHA peels. You generally follow the same course of action during and after both AHA and BHA peels, including the following. Before a chemical exfoliation service, discuss potential issues and contraindications during the client consultation. Explain the procedures, expected outcomes, and realistic goals. In a diagnostic facial or skin analysis before scheduling treatments, note on the client intake form the condition of the skin, including dehydration, hyperpigmentation, open lesions, and any other skin conditions. Also choose the type of exfoliant based on the condition of the client's skin and the desired results. Always keep in mind the manufacturer's instructions throughout the process and while performing the peel consultation. Eyewear is always recommended to protect the client and technician. OSHA requires that any time a corrosive agent is used, the technician must wear protective eyewear with side shields. An OSHA-approved emergency eyewash station is also required. Other precautions may be taken, such as applying occlusive barriers to the corners of the eyes, the mouth, and around the nostril area. Because the sun is stronger during the summer and outdoor exposure is more frequent, chemical exfoliation and other exfoliation procedures, example, microdermabrasion, should be used with extreme caution during those months and should be avoided in some cases where the client is not willing to take precautions to avoid inadvertent exposure during their daily activities. The manufacturer will provide instructions on the application and removal process. General application for basic peel involves cleansing, toning, applying the peel, processing according to the manufacturer's instructions, neutralizing if directed by the manufacturer, rinsing, and applying moisturizer and a product with SPF. During the application there will be slight stinging and tingling, and you may want to provide clients a fan to cool the face during the application. During the neutralizing or rinsing step, the peel may temporarily reactivate for a few seconds due to the water rehydrating the peel, and the client may experience an increased tingling or stinging sensation. Immediately after application, the client will have a rosy glow and even mild erythema of the skin. With a BHA peel, there may be salicylic crystal residue present, which should not be confused with frosting from a Jessner's or TCA peel. In some cases, when a 30% BHA is used, the client may experience frosting around thin skin, such as under the eyes, at the corners of the eyes and mouth, or even around blemishes, which is why some manufacturers recommend using an occlusive barrier in some areas. Sometimes a Woods lamp is used with BHA applications to view the accuracy and evenness of the peel application, as the peel can be illuminated by the lamp. What is a Jessner's or a TCA peel? A Jessner's peel is categorized as a stronger superficial peel and utilizes a Jessner's solution, which is a mixture of salicylic acid, resorcinol, lactic acid, and ethanol. You may find some of these formulas contain 2% phenol. Trichloroacetic acid peels are also known as TCA peels. Some states allow estheticians to perform superficial peeling with a Jessner's or a TCA. These peels are achieved at a superficial level by applying low percentages and fewer layers than are found with the medium-level peelings performed by physicians, which remove the entire epidermis and part of the papillary dermis. Both Jessner's and TCA peels work on the premise of protein coagulation, therefore, there will be flaking and peeling. How much peeling will depend on the intensity of the peel and the client. These peels are not neutralized and sometimes may remain on the face, with the client rinsing the residue off several hours later. Clients must be directed to follow all home care regimens to ensure optimal outcomes and to minimize complications. When to use Jessner's and TCA peels. When determining whether a specific treatment is appropriate for a client, consider the following factors: skin type, sebaceous gland activity, skin conditions, the client's philosophy of sun exposure, their cosmetic and product use, and whether they are using retin A, other acids/AHAs, or acne drugs such as tetracycline or doxycycline. Pre-treatment and home care guidelines are the same as those for AHAs, but you may add in products specifically to address aging or sun damage such as antioxidants or skin lightening agents. For those who have oilier and acneic skin, you may add in products such as an acne and blemish serum. Gessner's peels are primarily used on clients with oilier skin and acne, but are also used to address sun damage. The Gessner's solution is usually applied in several layers, according to the manufacturer's directions. You will find these peels are much stronger than AHAs, so you will most likely administer the peels only once every 3 to 4 or more weeks. Clients will notice flaking and peeling, so it is important to mention this in the consultation. TCA peels are used primarily for clients experiencing aging and sun damage. The TCA solution is usually applied in several layers, according to the manufacturer's directions. You will find these peels are much stronger than AHAs, so you will most likely administer the peels only once every 3 to 4 or more weeks. Clients will notice flaking and peeling, so it is important to mention this in the consultation. It is advisable to start with a lower strength and work up once you have a baseline for the client's reaction to the procedure. Series can be implemented according to your client's goals and the outcomes achieved. An example of a series is 4 TCA peels administered once every 3 to 4 weeks, then moving to maintenance with lower dose peels such as a 30% AHA once a month. The maintenance phase begins once the goals have been met and you and the client want to maintain the results. Always remember that if you are using a more advanced peel before the maintenance phase, a lower dose peel will not fully maintain the results, and a refresher peel, or series, needs to be administered periodically. Contraindications and best practices for Gessner's and TCA peels. The same course of action is generally followed during and following both Gessner's and TCA peels, including the following specifics. During the client consultation before a chemical exfoliation service, discuss the issues the client would like to address along with contraindications. Explain the procedures, the expected outcome, and realistic goals. In a diagnostic facial or skin analysis before scheduling treatments, note on the client intake form the condition of the skin, including dehydration, hyperpigmentation, open lesions, and any other skin conditions. Also choose the type of exfoliant based on the client's skin condition and the results desired. Remember to always consult the manufacturer's instructions throughout the process and while performing the pre-peel consultation. Eyewear is always recommended to protect the client and technician. OSHA requires that any time a corrosive agent is used, the technician must wear protective eyewear with side shields. An OSHA-approved emergency eyewash station is also required. Other precautions may be taken such as applying occlusive barriers to the corners of the eyes, mouth, and around the nostril area. Because sun is stronger during the summer and outdoor exposure is more frequent, chemical exfoliation and other exfoliation procedures, example, microdermabrasion, should be used with extreme caution during those months and should be avoided in some cases in which the client is not willing to take precautions to avoid inadvertent exposure during their daily activities. The manufacturer will provide instructions on the application and removal processes. The general application process for Gessner's and TCA peels involves cleansing, toning, applying the peel, processing according to the manufacturer's instructions, rinsing if directed by the manufacturer, and applying moisturizer and a product with SPF protection. During the application process there will be more stinging and tingling than is experienced with AHA and BHA peels, and you may want to provide clients with a fan to cool the face during the application. Sometimes a Woods lamp is used with BHA applications to view the accuracy and evenness of the peel application, as the peel can be illuminated with the lamp. Immediately after application the client will have mild erythema, pink or reddening of the skin, and there may be areas of frosting of the skin or an overall light frost, depending on depth of the peel, due to protein coagulation. With more superficial Gessner's or TCA peels, The frost will present as a whitish opaque haze, but you will still see the pink or redness below. With medium or deeper peels, when more layers have been added, the frost will become more pronounced. A few hours later, and especially the next day, the skin will become bronzed and will tighten over the next few days. Flaking or peeling will begin over the areas of the face that move the most, then all other areas will experience the same. The intensity of flaking or peeling will depend on the peel type and level of peel. It is important for clients to be instructed not to pick or peel off loose skin, as this may cause a wound that could result in post-inflammatory hyperpigmentation or scarring. Once the peel process has been completed and the skin has normalized, clients can return to their normal skincare products. What is a designer peel? To yield more targeted results, additional ingredients may be added to formulas, including pigment lighteners, acne ingredients, and moisturizers or hydrators. Table 13(1). Beneficial ingredients to combine with chemical exfoliation. Mature and/or sensitive skin: glycolic acid, lactic acid, ceramides, hyaluronic acid, phospholipids, linoleic acid, aloe vera, allantoin, kojic acid, licorice root, peptides. Hyperpigmentation: glycolic acid, kojic acid, licorice root, mulberry extract, bearberry extract, azelaic acid, ascorbic acid. Acne: glycolic acid, lactic acid, salicylic acid, azelaic acid, citric acid. Check-in. How do alpha-hydroxy acids exfoliate the skin? What are enzyme peels and typical results? What type of skin conditions benefit most from BHA peels? What is a Jessner's peel? Discuss ultrasound. Ultrasound and ultrasonic are synonymous terms referring to a frequency that is above the range of sound audible to the human ear. This equipment uses non-invasive sound waves to create results-oriented treatments. Ultrasonic equipment is based on high-frequency mechanical oscillations produced by a metal spatula-like tool. When to use and effects of ultrasound technology. Ultrasound technology in aesthetics can be used for product penetration and for cellulite reduction. The vibrations, created through a water medium, help cleanse and exfoliate the skin by removing dead skin cells. Ultrasound penetrates deeply, it stimulates tissue, increases blood flow, and promotes oxygenation. Keep in mind that the lower the frequency, the greater the penetration. Conversely, a higher frequency has less penetration. Cellulite is affected through the heat manipulation of the tissue and lymphatic movements performed with the device. Heat is created, and the vibration in the cells stimulates circulation, metabolism, and lymph drainage. The heat damage from ultrasound and other modalities, such as lasers, is what stimulates collagen production. Ultrasound also sends waves through the skin to assist in product penetration. This process is called sonophoresis, which is similar to iontophoresis. Iontophoresis uses electrically charged ions, so an electrical charge is needed from electrodes. Some aesthetic ultrasound equipment is rated as an FDA Class II device and may not be within an esthetician's scope of practice outside of a medical facility. Advanced training and technical research on equipment claims are necessary before using any advanced aesthetic machine. Different frequencies of ultrasound are also used for medical imaging, physical therapy, and pain management. Lower frequency ultrasonic devices are used for toothbrushes and jewelry cleaners. Handheld devices for a consumer's personal skincare that are used at home are milder but should be used in moderation to avoid damaging the skin. Because of its gentle, non-abrasive nature, this treatment can be a viable choice for clients with sensitive skin conditions or rosacea versus other exfoliating services. As gentle as ultrasonic therapy is, some clients are still not good candidates. Contraindications and precautions for ultrasound technology. Ultrasound contraindications include open or unidentified skin lesions, heart conditions, pacemakers or electrical implants, epilepsy, pregnancy, advanced diabetes, and cancerous lesions, or on anyone currently under a doctor's care for a condition that may be contraindicated. Like all machines, overuse can be damaging. Best practices and safety considerations for ultrasound technology. To avoid excessive heat buildup and unstable cavitation, it is important to maintain constant movement of the handpiece on moist skin. Caution should be exercised with fragile skin and in thin, delicate areas such as near the eye. Safety and maintenance for ultrasound machines. Ultrasound machines should be maintained in accordance with the manufacturer's instructions. The machine should be disinfected after each use. Check in. What is ultrasound and what is it used for in aesthetics? Discuss microneedling and nanoinfusion. It should be noted that not all states allow estheticians to perform microneedling or dermal rolling and categorize it as a medical procedure, requiring physician supervision. Microneedling or dermal rolling. Cosmetic and medical rolling, also called microneedling or dermal rolling, is a form of collagen induction therapy, CIT. This procedure causes tiny needle pricks across the skin from rollers or electronic handpieces that induce collagen formation during the wound healing process. Figure 13:16. Microneedling causes tiny needle pricks across the skin from rollers or electronic handpieces that induce collagen formation from the wound healing process. Nanoinfusion. Nanoinfusion is a popular technology used by estheticians in states that do not allow microneedling in an esthetician's scope of practice. Nanoinfusion technology includes the use of a microneedling handpiece but with needle-free nano tips versus the standard microneedling tip that has needles that puncture the skin and can penetrate to the epidermal or dermal level, depending on how aggressive you are with the microneedling handpiece settings. The nanoinfusion tip is a popular alternative treatment because it is not invasive. It uses a single-use sterile cartridge, made of silicone or surgical steel pyramid-like modules that are microscopic. The pyramid modules are smaller than one single strand of human hair, and almost invisible to the naked eye. This specialized design allows for a safe treatment with no downtime as the nano tips do not penetrate into the dermis. The science behind this treatment is to create thousands of microchannels per minute on top of the skin while the vibratory action of the microneedling handpiece assists in penetrating in the topical product of choice. Check in. What is microneedling? What is nanoinfusion? Describe spa body treatments. Spa treatments provide a wonderful, relaxing experience. Body treatments have a therapeutic effect and treat the skin of the whole body. They include wraps, scrubs, and masks. Be mindful of contraindications and allergies to ingredients, example, seaweed, nuts, before working on clients. Caution. Instruct your clients to drink lots of water to flush the system and rehydrate the body after detoxifying body treatments. If they do not replenish the water in the body, clients may feel tired or sick. Additionally, detoxifying treatments are not as effective when the body is not flushed and rehydrated with water. When to use and effects of spa body treatments. Body wraps are treatments where product is applied on the body and then covered or wrapped up. Wraps are used for various reasons and can remineralize, hydrate, stimulate, detoxify, or promote relaxation. The product used will determine the effects and results. Aloe, gels, lotions, oils, seaweed, herbs, clay, or mud products can all be used for wraps. Linens or plastic can be used to wrap clients and to promote product penetration. Blankets or sheets are the cocoon of the wraps. Inschloss wraps, another type of wrap, are designed to flush toxins out of the body and promote Inschloss. Inschloss wraps have a diuretic effect and are controversial in their effectiveness. If done properly, detoxifying the body may aid in weight reduction. Figure 13:17. Aloe, gels, lotions, oils, seaweed, herbs, clay, or mud products can all be used for wraps. Body scrubs use friction to exfoliate and hydrate, increase circulation, and nourish skin using a combination of ingredients such as ground nuts, apricot kernels, cornmeal, jojoba beads, honey, salt, or sugar combined with oil or lotion. Exfoliation treatments are also called polishes and glows. Exfoliation prepares the skin to receive additional products or treatments. Dry brushing is also beneficial and is used to exfoliate and stimulate the skin. Figure 13:18. A salt exfoliation treatment. Body masks remineralize and detoxify the body using primarily clay, mud, or seaweed mixtures. Certain body masks are used to treat cellulite. Clients are usually wrapped up after the mask application, and thus masks are similar to wraps. The ingredients and procedure used in the treatment determine whether the process is called a mask or a wrap. Figure 13:19. Application of a body mask. Hydrotherapy is another spa treatment that uses water in its three forms: ice, steam, and liquid. Hydrotherapy tubs, Scotch hoses, Vichy showers, Watsu-registered massages, hot tubs, steam rooms, saunas, cold plunge pools, foot soaks, and whirlpool baths are all different forms of hydrotherapy found in spas. Figure 13:20. The Vichy shower is used in hydrotherapy treatments. All spa treatments, especially intensive hydrotherapy treatments, can be powerful, so proper training is important before offering these services. Balneotherapy is the treatment of physical ailments using therapeutic water baths. Mineral, mud or fango, dead sea salt, seaweed enzymes, or peat are used in the baths. Balneum is Latin for bath. Figure in 13-21. Balneotherapy is another type of hydrotherapy. Stone massage is the technique of using hot stones and cold stones in massage or other treatments. Facial stone massage can be incorporated into regular facials. Figure 13:22. Hot stone therapy is a relaxing option for your client. Foot reflexology is the technique of applying pressure to the feet based on a system of zones and areas on the feet that directly correspond to the anatomy of the body. Reflexology is performed on the feet, hands, and ears as these are the areas that correspond to the body zones. It causes relaxation, increased circulation, and balance to the entire body. Estheticians are not usually trained in reflexology, so be aware of your scope of practice and licensing regulations. Reflexology is generally performed by licensed massage therapists. Massage can be dangerous if performed incorrectly. Figure 13:23. Foot reflexology chart. Ayurvedic concepts are based on 3 doshas, or mind and body types. Treatments include Shirodhara, figure 13:24, massage, and facials using ancient Indian concepts and ingredients suited to the 3 body/mind types, Pitta, Kapha, and Vata. Ayurveda originated over 5,000 years ago in India. It is a philosophy of medicine and balancing life and the body through various methods ranging from massage to eating habits. Ayur means life, vital power, Veda means knowledge. Ayurveda translates from Sanskrit as science of health or wellness. Shirodhara is an Ayurvedic treatment that consists of running warm oil on the third eye area of the forehead for 30 minutes. This relaxing, meditative process releases stress and calms the mind. Figure 13:24. Shirodhara is an Ayurvedic treatment that consists of running warm oil on the third eye area of the forehead. Sunless tanning product application is a service offered as an alternative to tanning. It is sprayed on or applied manually. Figure 13:25. Sunless tanning options are a safe alternative for your clients to get golden skin. Endermology is a treatment for cellulite. It helps stimulate the reduction of adipose tissue by a vacuum massage that combines a vigorous massage along with suction. Machines and other endermology methods are used in spas and in medical facilities. Reiki is a Japanese technique for stress reduction and relaxation that also promotes healing. It is administered by laying on hands and is based on the idea that an unseen life force energy flows through us and is what causes us to be alive. Other energy practices include energy balancing and chakras. According to ancient Hindu philosophy, our bodies have 7 major vortexes through which we process our life force energy, sometimes known as ki, or chi. A block in any of these power centers can create unbalance, disease, or an overwhelming sense of tiredness and feeling stuck. The focus of the chakra balancing is to identify any blocks in the chakras, open them up, and reconnect your energy body. Activity. Learn more about spa treatments. To learn more about spa treatments, here's a research idea. Check out the spa menus and brochures in your area or on internet sites. Professional trade journals and spa suppliers offer excellent information on a variety of treatment procedures. Many spa magazines are also good resources to gain insight into the industry. What body treatment services are you most interested in learning about? A nice way to learn is to experience the treatment yourself. Book an appointment to have a spa research day. Check in. What are body wraps used for? What is endermology? Discuss common treatments used to address cellulite. Cellulite appears as dimpled or bumpy skin caused primarily by female hormones and genetics. Cellulite consists of fat cells. Dermal fat cells do swell, but that is not the only cause of cellulite. Cellulite is visible when dermal fat cells are closer to the surface of the skin. This occurs from damage to the dermis. If water is lost and the tissue is weakened, then dermal fat begins to push into the dermis. Figure 13.26. Cellulite skin versus smooth skin. Additionally, if the epidermis is weakened or dehydrated, cellulite is more visible. Keeping collagen and elastin healthy helps reduce cellulite. To repair cellulite, cells and connective tissue need to be strengthened and hydrated through nutrients and water intake. Drinking water is not enough, our cells have to be able to hold on to the water. Wasted water in the body builds up and leads to water retention and puffiness. Blood flow and the circulation of nutrients through blood vessels up to the skin also affect cellulite. Repairing cell damage, connective tissue damage, and stratum corneum damage is important in treating cellulite. The following recommended nutrients and ingredients may be beneficial for cellulite reduction. Lecithin and lipids for cell walls. Glycosaminoglycans, GAGs, for moisturizing and firming. Glucosamine to build GAGs and connective tissue. B vitamins to retain moisture and provide nutrients. Amino acids for building collagen and elastin. Essential fatty acids to attract water for the connective tissue. Antioxidants. Anti-inflammatories. Aloe vera, an anti-inflammatory that improves hydration and contains enzymes and minerals. AHAs. Alpha-lipoic acid. The effectiveness of some endermology treatments is controversial. Detox diets, liposuction, and muscle-stimulating systems do not minimize cellulite. Some body wraps result in only a temporary water loss. Electronic devices with vacuums may reduce cellulite temporarily. Manual lymph drainage, mesotherapy, microinjection to the dermis to melt fat, dermal fillers, lasers, chemical peels, and microdermabrasion have all been tried to help reduce cellulite. Most of these techniques are considered to provide temporary results, and their effectiveness varies. Increasing blood flow, stimulating collagen and elastin, attracting water to cells, and repairing cell membranes are recommended to reduce cellulite. Additionally, reducing wasted water, preventing free radical damage, and reducing inflammation is part of a healthy approach to treating cellulite and the skin. Exercise, along with a healthy low-fat diet with a reduced intake of processed foods, is thought to help reduce cellulite. Professional cellulite treatments must be performed consistently in continuous sessions. A common spa treatment consists of exfoliation with a scrub or dry brushing followed by a detoxifying mask and wrap. These stimulate the metabolism and circulation. To finish the service, a cellulite treatment cream is applied. Did you know? Thalassa is Greek for sea. Exfoliation and skin brushing are also good for blood vessels and circulation. Another popular treatment is thalassotherapy. Thalassotherapy is the use of seawater as a form of therapy. Therapeutic benefits from sea and seawater products include many minerals and nutrients. Massage can also help soften hardened cellulite. Cellulite is a common condition for most women, and improving the health of the skin is a continual process. Explain the benefits of manual lymph drainage. Manual lymph drainage, MLD, stimulates lymph fluid to flow through the lymphatic vessels. When to use manual lymph drainage and effects of this modality. This technique helps to cleanse and detoxify the body. Congestion, water, and waste in the lymphatic vessels create edema in the tissue. Moving this fluid out of the body with light massage movements will decrease the swelling from excess fluid. MLD is a great addition to a facial or other treatments. It is also used both before and after surgery because it expedites healing and enhances cell metabolism. Mechanical lymph drainage is a very beneficial service performed with machines. Advanced training courses in MLD are available for both estheticians and massage therapists. However, some states require an advanced license before an esthetician can perform this service. Figure 13.27. Manual lymph drainage can cleanse and detoxify the body. Check in. Explain the benefits of manual lymphatic drainage. Describe the field of medical aesthetics. Medical aesthetics is a multi-billion-dollar industry. The industry is constantly developing new products and services for our youth-oriented society. Plastic surgery, laser treatments, and injectables focus on maintaining a youthful appearance. Medical aesthetics integrates surgical and non-surgical procedures with aesthetic treatments. Estheticians also perform services such as peels, microdermabrasion, and light therapy. Some assist with medical procedures and monitor patient recovery. Additionally, home care products recommended by the esthetician help patients heal faster and maintain their skin's health. Because medical aesthetics is evolving, the esthetician's role can be shaped to fit the facility's needs. Each setting varies, so it is important to define the responsibilities included in the esthetician's job description. Clinical estheticians are well-trained, experienced, and in some cases certified. However, not all estheticians must be certified to work in medical aesthetics. Most clinical procedures must be done in a medical office under a healthcare provider's supervision. Medi-spas are medical clinics and spas combined in one location and offer both aesthetic and medical services. The most popular medical spa services are chemical peels, microdermabrasion, Botox registered, fillers, laser hair removal, and light therapy/photorejuvenation. Estheticians are not qualified to perform certain procedures, but it is important to be familiar with all of them because many clients will be asking questions and utilizing these procedures. Society is now flooded with information on medical aesthetics. It is part of modern society's continued quest for instant gratification and maintenance of physical beauty. Medical spas are a fast-growing segment in the beauty industry. Pre- and postoperative care. Estheticians perform pre- and postoperative treatments and provide patient education before cosmetic surgery. These are important for faster patient recovery time. Estheticians also provide facials, light peels, extractions, and microdermabrasion prior to surgery. Camouflage makeup, retail sales, and patient home care counseling are other responsibilities in medical aesthetics. Preoperative care focuses on preparing the skin for the procedure. Getting the skin in its optimum state and as healthy as possible makes the surgery less traumatic on the tissue and shortens recovery time. Increasing the skin's metabolism and reducing cellular debris on the surface are part of conditioning the skin. Plan and schedule for pre- and post-op care are outlined by the medical staff before a patient's surgery. Post-op care includes providing skin care for rapid wound healing and the avoidance of infection. Decreasing inflammation, soothing and moisturizing, and providing for sun protection are the goals. Massage, hydration, protection, and camouflage makeup are often part of post-op care. Home care instructions for long-term maintenance are also important. Permanent makeup, sometimes referred to as micropigmentation, is another technique utilized in clinical aesthetics. Microdermabrasion and chemical peels. Glycolic treatments can be performed to precondition the skin before laser resurfacing or surgery. These lunchtime peels can enhance the strength and barrier function of the epidermis. Microdermabrasion benefits to the epidermis are similar to those provided by AHA treatments, although the effects are more superficial. Other clinical procedures. Numerous opportunities for estheticians are found in specialized clinical settings. Laser and medical centers offer hair reduction, spider vein removal, non-ablative wrinkle treatments, and other types of laser procedures. Non-ablative procedures do not remove tissue. Non-ablative wrinkle treatments use intense pulsed light, IPL, to bypass the epidermis and stimulate collagen in the dermis to promote wrinkle reduction. Estheticians can assist healthcare providers in these procedures if the technician is properly trained and certified. Other common procedures performed by healthcare providers include injectables of dermal fillers and Botox registered. Injectables. Botox registered and dermal fillers are injectables that are a large part of the industry. Injectables have become the fastest growing product in the medical spa industry. Injectable fillers are substances used in non-surgical procedures to fill in or plump up areas of the skin. FDA-approved fillers are non-toxic, durable, biocompatible, and easy to use. These are the necessary attributes of a safe filler. Botox registered. Botox registered injection is a popular non-surgical clinical service. Botox registered is a neuromuscular blocking serum, botulinum toxin, that paralyzes nerve cells on the muscle when this serum is injected into it. Botox registered is injected into the muscles to cause paralysis or diminished movement by blocking neurotransmitters. This relaxes tissues and diminishes lines. The glabella is the area between the eyebrows where muscles cause creasing from squinting or frowning. The glabella has strong muscles and is the most common site for Botox registered injections. Millions of Botox registered injections are performed annually in the United States. Figure 13.28. Botox registered is a treatment some clients desire. Dermal fillers. Dermal fillers are used to fill lines, wrinkles, and other facial imperfections. As we age, dermal collagen, hyaluronic acid, and fat are lost and skin loses its shape. The first fillers were from animal sources, specifically bovine collagen. Today, collagen treatments use a filler, usually a bovine, cow, derivative, to fill in wrinkles or to make lips larger. Dermal fillers last longer when used in conjunction with Botox registered. Today's fillers are obtained from a variety of sources. Many are combined substances and materials. Collagen may be derived from human or animal sources. Synthetic sources are silicone and hyaluronic acids, HAs. The newest trend is to use both non-animal and animal-based hyaluronic acid fillers. Juvederm registered is one of the many cross-linked HA fillers. Hyaluronic acid is a polysaccharide found in the body and connective tissues. A component of the skin's natural moisturizing function, it holds up to 1,000 times its weight in water. Cross-linking is a process in which ingredients are combined to increase a product's stability and durability. Another type of filler is aqueous calcium, which is calcium-based. Another injectable that is not a filler, but a dermal stimulator, is called polyl-lactic acid, PLLA. This product increases fibroblast activity and collagen production. New products are coming on the market regularly. Surgical procedures. There are two types of surgery, reconstructive and cosmetic. Reconstructive surgery is defined as that which restores a bodily function. This type of surgery is necessary for accident survivors and those with congenital disfigurements or other diseases. Cosmetic surgery, also known as aesthetic surgery, is elective surgery for improving and altering the appearance. Cosmetic surgical procedures. Common cosmetic surgery procedures are facelifts, forehead lifts, eye lifts, nose reconstruction, laser resurfacing, and deep peels. Iridodectomy is a facelift. This procedure removes excess fat at the jawline, tightens loose, atrophic muscles, and removes sagging skin. Figures 13:29a and 13:29b. Before, A, and after, B, a facelift. A forehead lift, also called a brow lift, can be performed separately or in combination with an eye lift. A blepharoplasty is an eye lift. It removes fat and skin from the upper and lower lids, making them less baggy and crinkled-looking. When sagging eyelids impede a patient's ability to see, it is a medical condition that may be covered by insurance. Figures 13:30a and 13:30b. Before, A, and after, B, an eye lift. A transconjunctival blepharoplasty is performed inside the lower eyelid to remove bulging fat pads, which are often congenital. Rhinoplasty is nose surgery that makes a nose smaller or changes the appearance in some other way. Sometimes rhinoplasty is necessary for health reasons and to improve the patient's ability to breathe. Laser resurfacing is used to smooth wrinkles or lighten acne scars. Collagen remodeling stimulates the growth of new collagen in the dermis. This type of laser treatment removes the epidermal layer and requires a recovery period. Figures 13:31a and 13:31b. Before, A, and after, B, a laser resurfacing treatment. Dermabrasion is a strong exfoliation method that uses a mechanical brush to physically remove tissue down to the dermis. It is a very deep exfoliation used primarily on scars. Lasers are replacing the use of this medical procedure. Do not confuse dermabrasion with microdermabrasion. Microdermabrasion is a mild, superficial mechanical exfoliation method. Trichloroacetic acid, TCA, peels are deep peels used to address sun damage and wrinkles. Phenol peels are the strongest peels and can be toxic. They are still used and are less expensive, but they require a longer recovery period than TCA peels or laser resurfacing. Body procedures. Many individuals are having elective surgeries. It is therefore important to be familiar with these procedures, especially if you are offering body treatments. Sclerotherapy minimizes varicose veins, dilated blood vessels, and other varicosities by injecting chemical agents into the affected areas. Lasers are a secondary method of vein therapy. Over 50% of women and 40% of men have varicose veins and smaller spider veins, telangiectasia, on their legs. Potential causes are heredity, race, gender, posture, hormones, and pregnancy. Trauma and injury causes inflammation to vessels. Phlebitis is the inflammation of a vein. To take pressure off veins, keep the legs elevated, wear compression stockings, avoid crossing the legs, exercise, and avoid being in stationary positions for extended periods of time. Mammoplasty is breast surgery that enlarges the breasts or reconstructs them. This procedure is also referred to as breast augmentation or implants. Breast reduction reduces or repositions the breasts. This is sometimes performed for health reasons, primarily to alleviate back pain. Liposuction is the procedure that surgically removes pockets of fat. An abdominoplasty removes excessive fat deposits and loose skin from the abdomen to tuck and tighten the area. The clinical esthetician. Working as a clinical esthetician in medical aesthetics can be enriching. This specialty requires compassion and patience because you will work with people who are in pain or who are experiencing physical trauma. Many patients feel more comfortable with the esthetician than they do with a physician, who may not have time for more personal and empathetic discussions. Remember to stay focused on the treatment goals and maintain a professional role at all times. The role of an esthetician can be invaluable in a medical setting in providing pre- and postoperative care and other patient services and education. Figure 13:32. The role of an esthetician can be invaluable in a medical setting in providing pre- and postoperative care and other patient services and education. A career in aesthetics is always exciting and fascinating. Advanced areas of study range from medical aesthetics to exotic body treatments. Light therapy and AHAs for skin care are two of the most effective tools available today to estheticians. Opportunities for advanced training are limitless. There are many services one can specialize in. As the industry continues to grow, keep up with modern technology and changes, even if they are not on your service menu. After basic aesthetic techniques are mastered, it is a natural progression to add advanced treatments to the services currently offered. This is the beauty of aesthetics, the increased ability to improve the health of the skin as the industry evolves. Educated and skilled technicians will always be in demand. Check in. What services do medical estheticians provide? What are injectable fillers used for? What are the medical terms for facelift, eye lift, and nose surgery? Procedure 13-1. Perform an enzyme mask service. Regulatory alert. Not all states allow estheticians to perform peels. Check with your regulatory agency prior to performing advanced procedures. As with all peels and procedures, make certain to obtain and maintain the highest level of training, certification, and licensure available within your scope of practice. Materials, implements, and equipment. 2x2 aesthetic wipes or cotton rounds. 4x4 moistened aesthetic wipes, or single-use sponges, cotton compresses, or facial cloths to be used with water in a bowl. Cleanser. Disposable spatula or fan brush. Enzyme mask. Gloves. Goggles/protective eyewear. Hand sanitizer. Magnifying lamp. Makeup remover. Moisturizer. Post-service supplies, disinfection solution, paper towels, etc. Protective eyewear. Standard treatment table setup with linens. Sun protection. Toner, appropriate for client's skin. Procedure 1. Complete procedure 7-1, pre-service including proper draping. Ensure the client is cleared for this service prior to proceeding. Discuss the expected outcome of this treatment with the client so they have realistic expectations of what the treatment can and cannot accomplish. 2. Wash your hands and put on gloves. Caution. As a new esthetician, until you are familiar with your client's reaction to this treatment, it is better to be more conservative than to encounter an adverse reaction. 3. Perform a visual analysis of the skin to ensure the skin is intact and to ensure the treatment is not contraindicated. Complete procedure 5-1, skin analysis. 4. Apply a cleanser suitable to remove makeup with your gloved hands. Massage the cleanser to loosen makeup. Remove the cleanser. 5. Using 2x2 gauze pads or cotton rounds moistened with toner, remove any residue. 6. Apply goggles to your client and yourself to protect the eyes from any irritants. 6. 7. Using a disposable spatula or fan brush, apply the enzyme mask beginning at the forehead and moving to the temples, then to the right and left cheeks, chin, upper lip, and nose. 8. Set a timer and process the mask according to the manufacturer's instructions. Note, remove sooner if client cannot tolerate the treatment or if the peel has processed prior to the recommended minimal end time. Endpoint goal, very light erythema. 9. Remove the mask using 4x4 moistened aesthetics wipes or chosen material. 10. Apply toner to the skin to remove residue. 11. Apply moisturizer and sun protection. 12. Remove your gloves and wash your hands. 13. Discuss your observations and any recommendations with the client. 14. Perform procedure 7-2 and 8-9, post-service. Expected response to enzyme peel mask. There should be no reaction beyond very light tingling or the absence of any tingling. If you are applying a mask you can see the skin through, it is expected to initially see the skin experience a very light erythema or even turn pink. The client may experience minimal or no tingling while the solution is actively processing. You are looking for pinkness, not redness, as this is an enzyme peel. Procedure 13-2, perform a back facial with enzyme mask. Materials, implements, and equipment. 2 times 2 aesthetic wipes or cotton rounds. 4 times 4 aesthetic wipes pads, or single-use sponges, cotton compresses, or facial cloths to be used with water in a bowl. Cleanser to remove makeup. Disposable applicator or brush. Enzyme mask. Gloves. Goggles/protective eyewear. Hand sanitizer. Magnifying lamp. Moisturizer. Post-service supplies, disinfectant solution, paper towels, etc. Standard treatment table setup with linens. Steamer, optional. Sun protection. Toner, appropriate for client skin. Warm towels in hot towel cabinet. Procedure. 1. Complete procedure 7 to 1, pre-service. Ensure the client is cleared for this service prior to proceeding. 2. Cleanse and analyze the skin. Apply a cleanser suitable for the client's skin type with your gloved hands. Massage the cleanser in circular motions. Remove the cleanser using 4 times 4 moistened gauze pads or chosen material. Complete procedure 5 to 1, skin analysis. 3. Using 2 times 2 aesthetic wipes or cotton rounds moistened with toner, remove any residue. 4. Using a disposable spatula or brush, apply the enzyme mask to the back area. 5. Process the mask according to the manufacturer's instructions. Remove sooner if client cannot tolerate the treatment or if the peel has processed prior to the recommended minimal end time. 6. Remove the mask using warm towels, 4 times 4 moistened aesthetic wipes, or chosen material. 7. Option, perform extractions. 8. Using 2 times 2 aesthetic wipes or cotton rounds moistened with toner, remove any residue. 9. Using a disposable spatula or brush, apply a mask suitable for the client's skin type to the back area. 10. Process the mask. 11. Remove the mask using warm towels, 4 times 4 moistened aesthetic wipes or chosen material. 12. Apply moisturizer in circular motions and then sun protection. 13. Remove your gloves and wash your hands. 14. Discuss your observations and any recommendations with the client. 15. Perform procedure 7 to 2 and 8 to 9, post-service. Procedure 13 to 3, perform a light glycolic peel. Regulatory alert: not all states allow estheticians to perform peels. Check with your regulatory agency prior to performing advanced procedures. Materials, implements, and equipment. 2 times 2 aesthetic wipes or cotton rounds. 4 times 4 moistened aesthetic wipes, or single-use sponges, cotton compresses, or facial cloths to be used with water in a bowl. Cleanser. Gloves. Goggles/protective eyewear. Hand sanitizer. Large-tipped cotton applicators. Light glycolic peel. Magnifying lamp. Moisturizer. Peel neutralizer. Post-service supplies, disinfectant solution, paper towels, etc. Protective ointment. Standard treatment table setup with linens. Sun protection. Toner, appropriate for client skin. Procedure. 1. Complete procedure 7 to 1, pre-service. Ensure the client is cleared for this service prior to proceeding. 2. Cleanse and analyze the skin. Apply a cleanser suitable for the client's skin type with your gloved hands. Massage the cleanser in circular motions. Remove the cleanser using 4 times 4 moistened gauze pads or chosen material. Complete procedure 5 to 1, skin analysis. 3. Using 2 times 2 aesthetic wipes or cotton rounds moistened with toner, remove any residue. 4. Apply a protective ointment around the eyes, corners, or the nose and on the lips. 5. Apply protective eyewear to your client and then to yourself. 6. Carefully analyze the client's skin with the magnifying lamp. 7. Using a large tipped cotton swab, apply the peel beginning at the forehead and moving to the temples, then to the right and left cheeks, chin, upper lip, and nose. 8. Process the peel according to the manufacturer's instructions. Neutralize and remove sooner if client cannot tolerate the treatment or if the peel has processed prior to the recommended minimal end time. Endpoint goal: mild erythema. Caution: some areas of the face may process sooner than others, and you may need to perform spot neutralization and removal on those areas. Sometimes a client's entire face may process sooner than the manufacturer's recommended minimal processing time, and you may need to neutralize and remove the peel immediately. 9. Using 2x2 aesthetic wipes or chosen material, neutralize the peel in the same order as applied unless you need to spot neutralize other areas first due to the peel reaching its endpoint sooner. 10. Remove the peel using damp 4x4 aesthetic wipes or chosen material. 11. Apply moisturizer and sun protection liberally. 12. Remove your gloves and wash your hands. 13. Discuss your observations and any recommendations with the client. 14. Perform procedure 7 to 2 and 8 to 9, post-service. Expected response to light glycolic peel solution. It is expected to initially see slight or mild erythema, which may be expressed in an uneven or a spotty appearance. The client may experience tingling or itchiness while the solution is actively processing. You are looking for slight or mild erythema as this is a light glycolic peel. Procedure 13 to 4, perform crystal-free microdermabrasion, diamond tip. Regulatory alert: not all states allow estheticians to perform microdermabrasion. Check with your regulatory agency prior to performing advanced procedures. Materials, implements, and equipment. 2x2 gauze pads or cotton rounds. 4x4 moistened gauze pads, or single-use sponges, cotton compresses, or facial cloths to be used with water in a bowl. Cleanser to remove makeup. Crystal-free microdermabrasion machine, diamond tip, and handpiece. Gloves. Goggles/protective eyewear. Hand sanitizer. Magnifying lamp. Moisturizer. Post-service supplies, disinfectant solution, paper towels, etc. Standard treatment table setup with linens. Sun protection. Toner, appropriate for client skin. Procedure 1. Complete procedure 7 to 1, pre-service. Ensure the client is cleared for this service prior to proceeding. 2. Cleanse and analyze the skin. Apply a cleanser suitable for the client's skin type with your gloved hands. Massage the cleanser in circular motions. Remove the cleanser using 4x4 moistened gauze pads or chosen material. Complete procedure 5 to 1, skin analysis. 3. Using 2x2 aesthetic wipes or cotton rounds moistened with toner, remove any residue. 4. Apply goggles to protect the eye area. 5. Engage the crystal-free handpiece with the hose of the microdermabrasion machine. Test the intensity of the suction over your gloved hand and adjust accordingly. 6. Begin at the forehead, then move to the temples, to the right and left cheeks, chin, upper lip, and nose. 7. Use light, even pressure holding the skin taut between the thumb and the forefinger as you move from one section to the next. 8. The number of passes should range between 1 and 3 depending on the thickness and sensitivity of the client's skin, the machine settings, and the point the erythema occurs. More sensitive clients and areas receive fewer passes. 9. Passes typically proceed as follows: horizontal, vertical, then diagonal. Passes can be performed independently over the entire face and then proceed to the next direction until the treatment is completed. However, Cross-hatching with 2 passes consisting of a horizontal then vertical action is used most frequently. 10. For smaller areas, such as the upper lip and nose, change the diamond tip size that best fits the area being treated. 11. Using 2x2 aesthetic wipes or cotton rounds moistened with toner, remove any residue. 12. Apply moisturizer and sun protection. 13. Remove your gloves and wash your hands. 14. Discuss your observations and any recommendations with the client. 15. Perform procedure 7 to 2 and 8 to 9, post-service. Expected response to microdermabrasion. It is expected to initially see slight or mild erythema. The client may experience pressure and a slight abrasive sensation associated with the handpiece. You are looking for slight erythema, not redness, as this is an aesthetic level microdermabrasion. Endpoint goal, mild erythema.